Okay, so Optimas, here's where we're at with the Optimas. The Optimas is a great place to start because it's all things skin. So if you have an aesthetic skincare center and you're doing facial rejuvenation, you have to have these technologies. I'm not saying you necessarily have to have InMode, but foundationally you have to have these technologies to treat these issues, or you're under-treating or inappropriately treating these patients, and you're not providing adequate facial rejuvenation. So on here, we have a ton of different opportunities. Remember, I told you one of my keys to lasting success was maximizing multiples? Guys, we made a big assumption when I made that statement. My assumption when I said that is you have multiples to maximize. Remember, the problem if you only have stuff in a syringe, you can't really maximize multiples well. You only have a few tools. So this is one way to garnish a bunch of tools to be able to maximize multiples, and it will not only drive revenues for the practice. That's not the main goal. It's not the main goal. The main goal is to provide comprehensive results for your patients. That is the main goal. And a nice byproduct of providing comprehensive results is, yeah, you drive more revenues for the practice. So this is an easy way to get into the space where you can drive multiples, because on here we've got things for soft tissue contraction, hair removal, vascular, photo damaged skin. It's one of the most versatile platforms on the market, and it's definitely the most versatile one InMode offers. Because of that, it is our #1 seller. Year to year to year to year, our Optimas is our #1 seller, and now 2024, it's been entirely redesigned with some new upgrades on the technologies. This is the family that you can get on Optimas. Don't let me confuse you, because we're going to walk through this. Hear me clearly. The Morpheus is absolutely a huge part of this device. It's on here. You can get it on here. There's no reason why you should get this device without it, right? Because the Morpheus is so special to all of us, it deserves its own lecture. I'm going to do that, I think, at 3 o'clock today, from 3 to 4. The Morpheus is different. You saw how many people across this hall had Morpheus. So because of that, rather than the old, like, this lecture, this is what it is, this is what it does, I'm going to get into the weeds a little bit, because most of the people I find have a Morpheus. So we're going to talk treatment settings. We're going to go through a ton of my pictures. I'm going to give you all my settings on the do's, the don'ts, the techniques. And so it's a little more clinically relevant lecture. It'll be from 3 to 4. So just know the Morpheus is on the Optimus, but we're going to hold a placeholder and press pause on the Morpheus, talk about that at 3 to 4. So we'll start with the rest of these devices on the Optimus. Is that all clear to everybody? Okay, so we've got the IPL, we've got skin tightening, we've got hair removal, vascular, so let's kind of dig into it with the absolute most boring thing that anyone could ever talk about, but we'll get it out of the way, and that's laser hair removal.